I'm going to. Okay. Um, Hello. Welcome to our presentation, our video presentation. We're going to start with talking about our social action and what we actually completed. Um, a little recap, our group was the one with the social problem being prisons prioritize punishment over treatment. And so for our social action, we kind of decided we wanted to partner with Yarrow and kind of see what they needed from us and what they would most benefit from. And so we decided to do that. And this is our logic model for what we thought was gonna go and how it was gonna play out. So we partnered with Yarrow and to distribute information in downtown Fort Collins on their harm reduction education programs. And we originally thought we were going to do like 5 businesses in downtown. And this all responds to the macro level need for education around the stigmas associated with substance use and people involved in the criminal justice system. And so at the beginning, we thought that we were going to need like 50 handouts from Yarrow. And if they didn't make them, then we were going to make them ourselves. And then we're like, okay, we're gonna need some cars or like transportation so that we can get to downtown and meet with each other or get to Yarrow to get pamphlets. And we originally thought we're gonna need about 4 hours of like coordination and meetings and 2 hours for distributing these resources and an hour to gain knowledge about Yarrow. So participants were us and Yarrow Collective, and then the small businesses in downtown Fort Collins. And we did think in the beginning that we were going to also talk to program directors at the downtown library and churches down there, but that didn't end up happening. Um, Outputs, activities, it was just initial reach out to Yarrow and kind of see what they needed from us. And when we did that, we found out that the thing that they needed most was not necessarily with individuals involved with substance use, but people around in the community around to kind of work on that destigmatizing, which is what we were talking about earlier. And so we reached out with them and then we found out that's what they needed. So we were thinking we are going to obtain pamphlets on October 22nd and then reach out to businesses. We thought we were going to originally do that. We didn't. And then we're going to distribute materials. Um, and then what we were going to track was the number of businesses that like accepted our pamphlets and ones that were like, no, get lost. And then also we're going to track the number of pamphlets that we were able to distribute. And then how we were going to track like the outcome was kind of tracking the number of community members utilizing their Yarrow groups, or we were going for a soupstone, yeah, meeting. So our impacts that we were thinking were going to happen and what we're kind of aiming for was increased community awareness about harm reduction and substance use and reduce the stigma. Oh my God, the stigma. I have too many young siblings. The stigma around substance use through education, as well as increase visibility and access to Yarrow groups. Um, yeah, and we were also thinking of enhancing community conversations about the openness about substance use and reduce barriers for individuals seeking treatment for support. And then, so a reflection of our what we thought was going to happen was the strengths. It was low cost, sustainable because you could leave the pamphlets out, and responsive to what the Yarrow community needed. And then weaknesses, we were thinking it is going to be harder to track, especially because we're just assuming that people are going to the mood or to these meetings. And then lessons learned that we didn't really think about or have time for is contact small businesses before giving out handouts. And so our assumption at the beginning of this was by participating with the local businesses and Yarrow Collective, we can engage the community in addressing this stigma about substance use through harm reduction education. This model empowers community members to take action and foster collaboration, making it a sustainable approach that aligns with Fort Collins values. And some external factors is we were thinking that we could receive some resistance from the community from people who hold negative stereotypes or misjudgment about harm reduction, and they wouldn't want to accept our pamphlets. So this is what actually happened. Pretty similar, except a few things changed. We focused more on giving out resources to about soapstone instead of just everything, or like harm reduction ones to the individuals using substances. We ended up only needing 2 hours of meeting time, and it only took about an hour to distribute the pamphlets around downtown. Activities, everything kind of stayed the same except for some dates changed around. For the product or like what actually happened, we were able to talk to 11 businesses in total, and 10 accepted and one rejected. And we were able to hand out 45 pamphlets, and we were unsure of how many community members actually utilized the group from this because we reached out to the Oral Collective and they said that they don't really ask where individuals come from or like where they found them. They just open them into the groups. So they weren't able to know, but they did say it seemed like it was a higher audience. Um, the impact stayed the same. The reflection stays the same, except for we learned that restaurants are usually less likely to let you leave pamphlets because they have stricter rules than small businesses. So that was the one that was rejected. And yep, our assumptions stayed the same. And then what is this one? The external factors. Yep, that was when we realized that the different types of business really varied in their willingness to actually support harm reduction. And that was really with just the restaurant. Even though we only did one, it was just an automatic turn down. So we just kind of stayed away from businesses from there. But yep, that is what we did. This is our pictures of where we left them. There's like the piano, one of the pianos in the parking lot, and we also left them on another piano and some stores. And there were a lot of bulletin boards too, where we were able to leave things up, which is pretty cool. Yep. Does anybody want to add anything to our social action? Are we good?
I think you did a great job. That's
Yeah. I think I would just add that we had, along with like the restaurant being denied, I think we had more, that was like a chain restaurant. So we had more success with like locally owned businesses. And yeah, that's it.
I think
So,
we also thought it was just better to go towards locally owned businesses as well. Not only because we think that, they might be more reflective, but also they're local and this is a local thing, you know.
Yep.
exactly. Right, sweet. Okay, well then we'll switch over to our community intervention plan computer. Okay. Can you guys see your fit? Well, I guess you guys have control of your own. Oh, we're filming. Okay. Sorry, I keep forgetting.
All right.
Okay. So for our community action, or this is the community intervention plan, our focus slash social problem was focusing on the incarcerated population. 2/3 of today's incarcerated population struggle with substance use disorder. Our current prison system prioritizes punishment as opposed to treatment and rehabilitation for individuals using substances. There is a lot of stigma surrounding this population, which is why it is important to bring information and resources to other jails in the counties so they have better access to these resources to get better and not just be punished during their time there. Um, we also want to focus on peer-to-peer support for a less judgmental environment. This includes like overall in the community as well.
Okay. So when it comes to our community intervention, the first thing that needed to be established was our change goal. And our change goal was just to work with the Yara Collective to expand on the community's knowledge of the services. That was our main goal in our project. We want to support them in their effort to help our community and our city with mental health support for those struggling with substance abuse and after incarceration. The goal of the change is there for there to be more engagement and more awareness of the organization. And it's about community voice and addressing the lack of resources for incarcerated individuals via community outreach and showing people that the Yarrow Collective is there to support them in that process. And yeah.
And then for our community practice model, we use the community development because, we're using something that's already been in the community, but we're just developing it to other places around, like Weld County. And what we were kind of thinking that this would do is just, reduce this stigma about substance use and people who are incarcerated by empowering the criminal justice system to offer alternative programs within the jails and for their inmates. Yes, and this engages with the cultural context of the community by building on allies and shifting power dynamics to reduce the stigma, which is what I was talking about earlier. And it also focuses on using existing resources, which is what I also mentioned.
So the root causes that we had addressed in this was lack of resources to those who are incarcerated, which is why we wanted to partner with the Yarrow Collective to bring some more of those resources in. And we want to expand this to other facilities in the Northern Colorado area. They're currently already have some programming within the Larimer County Detention Center, but we want to kind of like expand that further out. So focusing primarily on taking it to Weld County next. We want to expand the awareness of peer support programs and other non-traditional resources to address substance use. So this kind of looks like not telling somebody that they necessarily need to go to an inpatient rehab or go to seek out professional help, but really focusing on that peer-to-peer support to reduce that judgment. Um, Obviously rehabilitation over incarceration. We don't want to keep punishing these people and keep feeding this vicious cycle that we are currently in. Yeah.
You're muted, Tyler.
Thanks. So first and foremost, with coming into this, we have potential barriers, and first and foremost is proper funding. With any community outreach, you're gonna have to fight to find funding for something, especially something like this. With working with formerly incarcerated individuals, politicians, and the city doesn't necessarily want to go all out and help people coming out of jail. Um, and then moving on, finding that trust by people in the system to believe that someone even wants to help them, I think is a big barrier as well. And lastly, political influence, and touched a little bit on the how funding comes from policy and politics, and finding the politicians and the government to want to help and want to provide that money and funding is a pretty big barrier in this case. Yeah.
Okay. And our action steps for this proposal would be to first develop a formal partnership with Yarrow Collective and see if they would be wanting to even spread their resources to Weld County and what it would actually take to do that. And then we would also have to do the same thing with Weld County Jail and kind of see what that would look like and what we would need in order. Oh no, we're almost out of time. Okay. And then we'll also, oh no, I pushed the wrong thing. Oh my God. Go away. Okay, we'll just do that later. Whatever. She'll understand. Okay, and then year funding, like Tyler was talking about, it's definitely a tricky thing to get funding, especially in this amount that we were thinking. But there is the opioid amendment money, which seems like it could be a very viable option. And then also establish a leadership team, including maybe other partners. So not just the RO collective, we could do Matthew's House, Summit Stone, Parents Cafe, anything like that. And then we're also thinking we would have to train maybe some people internal to Weld County, individuals that are incarcerated in peer support, and so that we can broaden our outreach. And then to see if this is all working, we would gather feedback with a survey to the inmates, trying to see if, and also look at recidivism to see if people are actually coming back to the services, and also tracking attendance and engagement to see if it is working. Okay. We have 8 minutes. Can do it.
Okay. So our short-term goals includes bringing programs into Weld County jails to obtain $5,000 in funding to start the program. And then to assess the program, we're going to make and distribute surveys. A survey will be passed out in week 4, and it will determine what is working and what is not working. We also want to train 5 individuals who are incarcerated in peer support. Like we've been saying, how peer support and lived experience is really important. So we think it would be beneficial. Engage 4 other organizations to start a project leadership team. This will help more of the community member to be involved, and then we will have access to more resources. This will all be assessed with surveys, and then that's how we will know if we're successful. Our long-term goal includes expanding the program to other Northern Colorado jails, train 20 individuals who are incarcerated in peer support, obtain $15,000 in a year for sustainable funding, increase rates of rehabilitation in facilities, decrease substance use among those who are being released from the facility. Statistics will measure and be recorded by both the facilitators and staff in the jails. And then for longer time goal, we want to attempt to talk to local leaders and discuss the importance of rehabilitation and push for policies that enact change.
Okay. So talking about the why a little bit, we selected this intervention because we want to expand the community's knowledge. I feel like a lot of people in Fort Collins and Larimer County and Weld County don't have a lot of knowledge of what's out there to offer them. And doing this, we want to support the effort and help our community and our city with mental health support. It's a huge deal. We also wanted to just create more engagement and more awareness for the organization and emphasize the available resources and increase communities' capacity to act sustainably. This is a very important thing to us, and yeah, I think that we did what we set out to accomplish. And so that our targets of change were the Yarrow Collective, which we already had connections and a model for programming. Our target action is to start new programming and expand those resources outside of just the Yarrow Collective, and to help out with peers. That's including currently and formerly incarcerated individuals who have lived expertise that they can offer and serve as peers. We want to spread the word, and we want to serve as peer supporters in this group and in this community.
So for cultural responsiveness, people of color have been disproportionately criminalized for substance use and make up a large percentage of those in jail. To help people of color in the best ways, the staff will be receiving diversity and inclusion training. And there is also a commitment to recruit people of color who can better advocate and relate to these marginalized groups. We also, access to substance use treatment also affects low income communities. That is why We are reducing barriers and bringing rehabilitation programs to them into the jails. There are also no-cost groups as part of Yarrow Collective that help support people looking for a support peer group outside of jail. We will be using existing services and bringing them to the Weld County Jail, making it more cost-effective and overall easier for people to access.
Wait, no, you're unmute or you're mute.
Thanks. Some of our existing community resources and allies include the Northern Colorado Health Network. They offer services like HIV and AIDS support, STD testing, and harm reduction at low cost or no cost. They engage within the community to do outreach to meet clients where they are at. Collaborating with the Northern Colorado Health Network increases awareness and connects affected populations to these vital resources. Another one would be the Northern Colorado Health Alliance. They provide community health services and peer-to-peer support. They have education and support for individuals with lived experience in addiction and incarceration. This will help reduce the stigma and foster comfort for individuals seeking services so they don't feel so off put by the professional standard. And the Weld County Jail, they're going to be a key partner, obviously, in reaching these incarcerated populations and expanding the programming from Larimer County to Weld County. We will definitely need support from the jail leadership to implement the programs effectively, and obviously we would need permission to enter within the jail and bring these programs and go and do training. And also educating staff can help reduce stigma and demonstrate the focus on harm prevention and not enabling substance use, which is really important for the staff to understand that these people are people and not just bad people. Yeah. And our resources are down there at the bottom.
Oh yeah. Okay. I think that's all.